Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Anthony Porto. Hello, Anthony.
Hey, Jess.
So today we are going to talk about milk and milk alternatives. The clock is ticking, so let's get to it. Anthony, why is milk recommended for infants and toddlers?
So milk and dairy products can really help infants meet their caloric goals for growth, as well provide enough fat for brain and eye development. So usually at 1 year of life, babies should consume about 2 servings of dairy per day, or about 16 to a maximum of 24 ounces of whole milk per day. Between 2 and 3 years of age, child should consume about 2.5 servings of dairy per day. Whole fat milk is recommended typically until 2 years of life, unless there's a family history or risk for obesity or heart disease.
Okay, so what are some common milk alternatives available for children, and are they a suitable replacement for cow's milk?
This is something that we're getting a lot of questions on right now because parents are choosing to use a milk alternative. And the answer is there's many out there. We know almond milk, soy, oat, rice, pea-based protein. While all of these can be suitable as a replacement for cow's milk, we really want to make sure that they provide similar nutritional benefits, and that's where it can be more variable. So we want to check labels to make sure they have calcium, vitamin D, and other nutrients that are essential for growing kids. When looking at labels, think about how much a child should normally consume. Infants need about 400 international units of vitamin D and between 200 and 260 milligrams of calcium, while toddlers need 600 international units of vitamin D and about 700 milligrams of calcium per day.
I've never heard anyone say what the IU abbreviation stands for, so that's helpful to know. So why might a parent choose milk alternatives for their child?
So as a pediatric gastroenterologist, I see parents choosing it because their child has a milk allergy, so they're trying to figure out how to get similar calories into their child. Sometimes other health concerns or personal dietary choices, and some kids just don't like the taste of milk. So it's really essential to choose an alternative that aligns with the child's nutritional needs and preferences.
Okay, so are there any nutritional concerns or considerations that parents should be aware of when using milk alternatives?
Yes, absolutely. There are some milk alternatives that lack certain nutrients. I think the biggest one we think about when you compare it to cow's milk is protein. So we have seen toddlers who are drinking milk alternatives in large quantities. So some kids at 1 year doesn't mean they may not get enough of their calories by solid food. They may be drinking more milk than we normally think. And if you're drinking a milk alternative with low protein, we've seen them lead to poor weight gain as well as having low protein in their blood. So it's really crucial to make sure that you're using a fortified option, as well as know if your child's having a well-balanced meal outside of the milk or milk alternative that they're drinking. The other thing to watch out for is that some of these are sweetened, so there may be added sugars, and we try to avoid added sugars in all children, but especially those under 2.
So I remember always being concerned that my kids were not getting, the necessary nutrients. So how can parents ensure that their child is getting the necessary nutrients when using these milk alternatives?
So I think you want to know how much your child is drinking. You want to make sure that when you go to the pediatrician that they're gaining weight appropriately, and really focus on not what your child ate today for dinner, because as a parent of toddlers, you know that it may not be anything. And so you want to say, how much did my child eat over a course of a week to make sure they're getting all of their balanced nutrition, making sure that they have a variety of food, and then speak to your pediatrician or dietitian if needed. If your child drinks more of their calories than actually eats them, then choose one that has high protein and has more nutrients that are comparable to cow's milk. And this could be, in my mind, in order of decreasing from the most protein. Pea-based protein has comparable protein to those in whole milk. Soy, oat, and hemp milk have the higher ones compared to coconut, rice, and almond milk, which has less.
So I've seen a lot of myths and misconceptions out there about milk alternatives. Are there any that you'd like to debunk?
I think we've been talking about it, but I think it's worth just summarizing, is that in an adult, when we add almond milk to our coffee or things in the morning, that's really a small amount of our calories. but really they're not all nutrient equivalent. And so we really want to make sure that if your child is not someone who consumes a well-balanced diet, that you need to read the labels and be mindful of these differences to make sure that what you're giving your child is appropriate for their adequate growth and development.
All right. Well, I learned a lot. We hope you learned a lot, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.